taking control of your health birth control options. Explained. Hey everyone, it's Heather. Welcome back to my channel where we talk all things health and wellness. And today, we're diving into a topic that's super important, but sometimes can feel a little awkward to discuss. Birth control. But trust me, there's nothing to be embarrassed about. We're all about taking charge of our health, and understanding your birth control options is a huge part of that. Whether you're just starting to think about it, or maybe you're curious about other methods out there, I'm here to break it all down for you in a way that's easy to understand. We're going to explore the pros and cons of different options, talk about some common side effects, and by the end, you'll feel empowered to make the best choice for your body and your life. So, let's jump right in. Birth control pills. Tiny pill, big impact. First up, let's talk about the birth control pill. It's probably one of the most well-known methods out there, and for good reason. The pill is super effective at preventing pregnancy when taken correctly. It basically works by using hormones to stop ovulation, which means your ovaries won't release an egg each month. No egg, no pregnancy. Plus, a lot of people find that the pill makes their periods lighter, less painful, and more regular. Like say goodbye to those surprise visits from Aunt Flo. Now, like all medications, there can be some side effects. Some people experience things like breast tenderness, mood swings, or even nausea, especially when they first start taking it. But the good news is, these usually go away after a few months. It's important to remember that everyone reacts differently, so what works for your bestie might not be the best fit for you. One thing I want to address is the concern about weight gain. It's a common one I hear a lot. While some people might experience some fluid retention, the pill itself doesn't actually cause weight gain. It's more about those lifestyle factors we always talk about, like diet and exercise. The important thing is to talk to your doctor about any concerns you have. They can help you figure out if the pill is right for you and find the type that best suits your individual needs. The patch birth control on autopilot. Next, we've got the patch, which is a really convenient option for some people. Imagine this. You just stick this small, discreet patch on your skin once a week for 3 weeks, then take a break for a week, and that's it. It works similarly to the pill by releasing hormones into your bloodstream to prevent pregnancy. One of the biggest perks of the patch is that you don't have to remember to take a pill every day, which is a major win for busy bees or anyone who, like me, has a hard time remembering to drink enough water. Plus, it's super discreet, kind of like a secret weapon against unplanned pregnancies. However, it's important to be aware that the patch can come with similar side effects to the pill, like breast tenderness or mood swings. And some people might experience skin irritation where they apply the patch. Another thing to consider is that the patch might not be as effective for those who are overweight or obese, as the hormones may not be absorbed as well. Again, it's all about having those open conversations with your doctor to find what's right for you. Chapter 3. IUD, long-term protection, short-term procedure. Now let's talk about the IUD, which stands for intrauterine device. Don't worry, the name sounds way scarier than it actually is. An IUD is a tiny T-shaped device that gets inserted into your uterus by your doctor. It's a long-acting reversible contraceptive, meaning it can prevent pregnancy for several years without you having to think about it. Talk about easy. There are two main types of IUDs, hormonal and non-hormonal. The hormonal IUD releases a small amount of hormones to prevent pregnancy, while the non-hormonal one uses copper, which is toxic to sperm. Both are super effective, and one of the biggest advantages of IUDs is that they last for years. It's like setting it and forgetting it. This makes them a great option for people who are looking for a hassle-free method. Of course, like any medical procedure, there are some potential risks and side effects. Some people experience cramping or irregular bleeding after insertion, but this usually subsides after a few months. It's important to note that IUDs don't protect against sexually transmitted infections, so using condoms is still crucial. Chapter 4. Beyond the basics, exploring other birth control options. So, we've covered some of the bigger players, but the world of birth control is surprisingly diverse. Let's explore some other methods that might pique your interest. First up, we have the ring. It's a flexible ring that you insert into your vagina, much like a tampon, and it releases hormones to prevent pregnancy. You wear it for 3 weeks, take it out for a week to have your period, and then pop in a new one. Pretty straightforward, right? Then we have the implant, which is a tiny matchstick-sized rod that gets inserted under the skin of your arm. It releases hormones to prevent pregnancy for up to 3 years. It's super effective, and you don't have to deal with remembering to take a pill or change a patch. And let's not forget about barrier methods like condoms. Condoms are the only method that protect against both pregnancy and sexually transmitted infections, so they're a must-have no matter what other methods you might be using. There are even more options out there, like diaphragms, cervical caps, and fertility awareness methods. It's all about finding what works best for your lifestyle, your preferences, and your body. Phew, we covered a lot of ground today, but the most important takeaway is this. There's no one-size-fits-all when it comes to birth control. What works for your best friend, your sister, or even that influencer you follow might not be the right fit for you. Remember, taking control of your reproductive health is empowering. Don't be afraid to advocate for yourself, ask questions, and work with your healthcare provider to find the method that aligns with your needs and goals. If you found this video helpful, give it a big thumbs up and share it with a friend who might benefit from this information. And don't forget to subscribe for more health and wellness tips. Until next time, stay healthy.